Are you feeling more anxious, restless, or unable to sleep after finishing a course of antibiotics?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining how antibiotics can alter your gut-brain signaling, and why that shift can trigger anxiety, mood changes, and sleep disruption, even when your infection is resolved.
I'm Alara Sky. We'll walk you through human research linking antibiotic exposure to changes in neurotransmitters, short-chain fatty acids, stress hormones, and brain immune activity. You'll learn what that means for your mental state, and which concrete steps from the evidence can help restore stability.
Antibiotics influence your nervous system through the microbiota gut-brain axis. In controlled human and animal studies, antibiotic exposure raised anxiety symptoms while disrupting gut bacteria, reducing short-chain fatty acids, and altering lipid metabolism. These changes were not theoretical. They tracked directly with what people reported feeling.
One mechanistic finding stands out. Acetylcholine levels dropped in stool, colon tissue, blood, and the hippocampus after antibiotics. Acetylcholine helps you shift from alertness to rest and digest. When it falls, you remain keyed up. Lower acetylcholine strongly correlated with higher anxiety scores, and restoring this pathway in animals reduced anxious behavior.
Researchers also observed a loss of specific Bacteroides species tied to acetylcholine production. That pattern appeared in both mice and humans, suggesting a shared, direct gut-to-brain link. When these microbes decline, acetylcholine declines, and anxiety rises.
Short-chain fatty acids such as butyrate fell after antibiotic use. These compounds support gut barrier integrity and normal neural signaling. When they're low, the communication between your gut and brain becomes unreliable, and your baseline shifts toward vigilance rather than calm.
At the brain level, microglia, immune cells that respond to stress, shifted into an activated state when acetylcholine decreased. That activation increases reactivity and reduces resilience, making ordinary stressors feel heavier and harder to shake.
Beyond acute effects, repeated or early life antibiotic exposure increases longer-term vulnerability. Large database studies associate cumulative antibiotic courses with higher odds of anxiety and depression, and evidence shows early exposure can alter stress responses and behavior into adulthood.
Those population findings fit with physiology. Antibiotics can activate the hypothalamic pituitary adrenal axis and keep stress chemistry elevated. Several studies also observed changes in brain-derived neurotrophic factor, a protein involved in learning, mood stability, and adaptation. When these systems are disrupted, anxiety feels physical because it is.
Antibiotics can also increase intestinal permeability by disrupting the tight junctions that keep your gut barrier intact. Greater permeability allows inflammatory molecules to circulate more readily, adding to the strain on mood regulation.
There's an important nuance. Antibiotics can provoke anxiety, confusion, or even psychosis in some people, yet relieve brain-related symptoms in specific medical contexts. For example, reducing ammonia-producing gut bacteria can improve symptoms tied to liver-related brain dysfunction. The mental effect depends on which microbes are reduced and what they were producing.
For practical steps, start by limiting antibiotic use to situations where they're clearly required. Many common respiratory illnesses are viral. Before beginning a prescription, ask whether the infection is bacterial, whether a 48 to 72-hour watchful waiting window is appropriate, and what alternatives exist if antibiotics aren't necessary.
Remove hidden antibiotic exposure from your diet. Conventional meat can come from animals given antibiotics, which means small repeated doses for you. Choosing antibiotic-free pasture-raised or organic meats reduces ongoing microbiome pressure that can perpetuate anxiety.
When a prescription isn't warranted, consider natural antibacterial options. Medicinal honey and oregano oil have antibacterial activity without the same level of microbiome disruption. These are options for situations that do not require pharmaceuticals.
Stabilize energy during recovery. Consistent meals with adequate carbohydrates support calmer brain chemistry. Gentle daily movement, especially walking outdoors earlier in the day, supports circadian rhythm and nervous system recovery.
Minimize your intake of linoleic acid. After antibiotics, inflammatory fats can aggravate gut damage. Linoleic acid is found in vegetable oils, nuts, and ultra-processed foods. Swap products containing it for alternatives like tallow, grass-fed butter, or ghee. Avoid alcohol to reduce gut irritation and neurological stress.
Rebuild microbial diversity with fermented foods prepared traditionally using clean, organic ingredients. Sauerkraut, kimchi, grass-fed yogurt, and kefir provide probiotics that help restore stability. Adding these regularly supports a more resilient gut-brain axis.
During and after treatment, reduce daily stress load. Prioritize sleep, keep exercise gentle, postpone major stressors when possible, and start mornings with a few minutes of quiet breathing or light movement. Eat regular meals to prevent blood sugar swings that intensify tension.
Use simple evening habits to improve sleep quality. Step away from stimulating screens at least an hour before bed and keep lighting low. These routines ease nervous system overload and make anxiety easier to manage while your microbiome recovers.
If symptoms appear suddenly after antibiotics, recognize the pattern. Rapid changes in key microbes can quickly alter neurotransmitters and stress signaling. Understanding that biology helps you focus on steps that restore balance rather than questioning your resilience.
Today's challenge is straightforward. If you recently used antibiotics or know they're in your near future, select 2 actions from this discussion and apply them for the next 14 days. For example, eliminate vegetable oils and add 1 serving of traditionally prepared fermented food daily, or switch to antibiotic-free meats and commit to a morning outdoor walk. Track your sleep quality, irritability, and ability to concentrate so you can see whether your nervous system stabilizes. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.